watching on the recorded version. Uh, Sorry for this network delay. We are facing some technical issues regarding the network, and we are very much sorry that we are being delayed for 10 minutes. And so, without wasting any more time, before that, all the e-participant certificate link will start on the later version, means after 9 or 9:30. So be there with us. Be there with us to just stay there. And also, without wasting any more time, let's just jump into our 30 seconds countdown time.
Good evening, sir.
Good evening. Very good evening to all of you.
Good evening, all the viewers across the globe, and welcome to our 105th episode of Continued Medical Education, organized by National Institute of Homeopathy Alumni Association, and paying respect to our beloved President, Dr. Debnaran Kalyani, sir. With your permission, let us call our inaugurator tonight.
Please call him.
Thank you, sir. And our inaugurator tonight is a dynamic homeopath who had done his master's in public health from University of Kalyani, and he is also with me as a doctor in Cricket Association of Bengal. I'll request Dr. Tousif Jamal to inaugurate the 105th episode of our CME tonight. Dr. Tousif Jamal. Dr. Orko Mukherjee, can you bring on Dr. Tousif Jamal on screen? Every now and then we are facing network challenges. I think Dr. Orko is also facing some network issues. Over to you, Dr. Jamal.
Good evening, everyone. Good evening, sir. This is Sir Kalyani,
Good
sir.
evening. Good evening. Very good evening.
Thank you for involving me as an inaugurator for this 105 CME by National Institute of Homeopathy Alumni Association. Today we're going to learn about some rare medicine for sciatica by Dr. Shatashree Didi. Rare medicine is rare and we rarely use it, but when it implement and is successfully used, then we can see the very impressive result. So now we are going to learn from Dr. Shatashree. Thank you. Stay watch.
Very good evening to all my respected viewers. Good evening, Kalyani sir, Bidyut and young dynamic inaugurator Dr. Tousif Jamal, and I welcome Dr. Shatashree Ghosh also. Both are of my students. I am feeling glad to share the dais with all to my young students. Sciatica is 1 minute, please. Sciatica, a frequently met condition in our clinic, which hamper the day-to-day activities. 1 minute, please. Day-to-day activities. It is not a new condition. It is a old condition that we find in the history of medicine also from the Hippocratic era. Hippocrates used to call it as a sciatica, and he referred the case most commonly found between the age of 40 to 60 years of old. And what he told ki the symptoms which confined to the hip area, prognosis may be bad, whereas the symptom, if it is extending up to the heel, the prognosis may be a good. The first book on the sciatica came around about 1786, 1754 by Italian anatomist Domenico Cottungo, and the disease was previously known as Cottungo disease. And he is the first person who gave a clear-cut idea about the sciatica and differentiate the sciatica from the other type of pain that frequently patient suffers from back pain or extremities pain. By the first half of the 19th century, sciatica was thought to be due to the various rheumatic condition. And by the first part of the 20th century, with the advancement of the knowledge and the pathology, the causative factors of the sciatica, another addition was intervertebral disc. Since then, we came to know the role of the intervertebral disc in the development of the sciatica. So the most frequent cause of the sciatica, what we have found, herniated disc, injury, different type of inflammation or the infections, spinal mass or different type of malignancies, or wear and tear with the disease, with the life, with the advancement of the ages, or lifestyle issues. So homeopathy has a great scope in the management of all the causes of the sciatica along with the symptomatology. We have lots of the medicine by which we can control this disastrous condition of the patient. Without adding much, I am asking Dr. Shatashree Ghosh. Over to you, Dr. Shatashree.
Good evening, everyone. Good evening, my respected teacher. Am I audible to all of you?
Yes, ma'am, you are audible.
Okay. Good evening to all of my respected teachers and those who all have joined today. And myself, Dr. Shatashree Ghosh. I was a proud ex-student of NIH, and I would like to thank first Dr. Bidyut Mukherjee sir for giving me these opportunities. The agenda of today's seminar is the sciatica and its neglected homeopathic medicine or rare homeopathic medicine. Slowly and gradually, throughout the session, I will take you through my experiences and observation regarding sciatica. Hopefully, together we all have enjoyed the session. And without wasting the time, if you all permit me, I will begin the session. Just wait for a few minutes. I will share my slide. Okay.
Ma'am, would I help you with that? Ma'am, should I help you with that?
Is my screen visible, Orko? Orko, is my screen
Yes, ma'am,
visible?
your screen is visible. Yes, ma'am.
Okay.
Your screen is visible.
Okay. And okay. And my topic is sciatica and its remedies
Ma'am,
with some
one
rare.
issue. Ma'am, there is one issue. Have you turned on the slideshow, right?
Yes, I'm done.
That's why it is showing a different thing. Let me just guide you with that. Just click on the stop sharing one. Means click on the stop sharing button once. and
Okay.
then come to again the present part. Let me guide you with that. I know it's a delayed issue, but let me just guide you with that. Click on the present button.
Okay.
After clicking that, then you can see that slide and PDF option.
Okay.
And then you go
Then
to your computer, it's like Google Slides or your computer, just click on your computer.
okay. Then
Then after clicking that, you have to just select that slide over here. Then just select the slide, find the slide in your computer, and then just click on it. It will take some time to process, and after which you will just the main thing will come up. What
okay.
you are seeing, ma'am?
There is a window showing the processing the presentation.
Yes, ma'am. What's it showing?
Processing presentation.
That means it's processing. It will take some time. Like if the
Okay.
net is perfect, then it will go on. Just give him few minutes or few
Okay.
seconds or so. It will take some time to process because the StreamYard thing just takes this security thing and everything. So that's why, ma'am, just give
Okay.
few minutes or few seconds. Just wait for that. Um, until then, to all the viewers, please just hold on, stay back, and as you can see, ma'am slides
Orko,
is ready.
Orko, is this visible?
You can just now. Yes, yes, yes. You can just see your slide. You can just see your slide. Just
Okay,
click on
okay.
that
I can
arrow
see.
button. Yes, just click on the arrow buttons. You
Arrow.
can just move.
Okay, I can change the slide. Okay, okay.
Yes, yes.
Okay.
Okay. Over
Okay,
to you.
thank you, Orko. Okay. Okay, and my topic, okay. Topic is sciatica and its remedies with rare homeopathic medicine. First, I discuss here what is sciatica. We all know that sciatica is the pain that generally caused by the sciatic nerve in the piriformis muscle. That pain travels along the path of the sciatica nerve. The pain generally starts from where the low back and generally our buttock region behind the thigh and radiating down below the knee, and sometimes it may reach into the ankle. And here you can everyone can see I am giving a small picture of that, and that red area can denoting the area of the pain. And next I'm going to the next slide, the etiology. The etiology of the sciatica is first of disc herniation, then spinal stenosis, then spondylolisthesis, and others. Others may include the irritation of the nerve from the tumor, bone, and some internal bleeding, infections like that, and some injury like that. From the slides onwards, I will discuss the every medicines according to that. That if what is the medicine we use from injury, and sometimes the pregnancies may cause the occur the irritation of the sciatica nerves that also cause the sciatica pain. And I just discuss a small part of disc herniation. What is the disc herniation? The disc herniation is generally occur at different level of our vertebral column, but for the sciatica it's generally occur in the lumbosacral vertebra, and the most common vertebrae are L5 and S1. Next, we come to the point of spinal stenosis. Spinal stenosis, that everyone will know that it's the narrowing of the vertebra, and that is generally result that too much pressure in the spinal cord. This most general cause I just discuss here. The most general cause of spinal stenosis is the age-related issue. And then next our cause is spondylolisthesis. Then spondylolisthesis is the slip over the vertebra in the spinal column. It's also a degenerative cause, but listhesis, the vertebrae slip forward into the bone. Spondylolysis is another thing, and spondylolisthesis is another thing. Next, the piriformis symptoms. Everyone know that piriformis muscle, its origin and insertion, but sometimes this neuromuscular syndrome, the sciatica nerve is compressed between the piriformis muscle, and between for this compression, this causing pain, tingling sensation, and some numbness. And another cause is the wallet sciatica. That generally men are suffered from this, that they are sitting with a large wallet in the affected site in rear pocket. Okay, next I'm some discussing some iatrogenic cause, like during surgery of this area, any surgical trauma, and during anesthesia, any faulty positioning, some neurotoxic injection, some tourniquets, and nowadays the most common disease is cancer, and for this radiation, also sometimes cause the sciatica pain. Next, I just brief discuss the symptoms of sciatica. The typical symptom is that the pain radiates from the lower back or buttock down, and the pain feels come along the sciatica nerves because of its location, and it generally originates and irritates from the all other nerves in lower spine. Generally, symptoms that includes are dull pain, aching pain, burning pain, and starts the lower back region and comes towards backwardly to leg, back pain, and the sciatica is the sometimes some neurological symptoms is there, just like numbness, tingling, intense hot and cold sensations, and others. Sometimes the reflexes also altered. Sometimes the muscles are weakness, and sometimes the symptoms may aggravate during the twisting the low back region and raising the painful leg, and sometimes also coughing, sneezing, and straining. I all discussed the every medicine that which we use in during aggravation from coughing, sneezing, like that. Okay. Next, that I discuss of investigation, that straight leg rising test. The straight leg rising test is a diagnostic procedure that performed during the physical examination. The clinician do that patient is lying down in the lying down in the bed, and the patient, if the straight leg is done actively by the patient, this stage is functional leg strength. That particularly it's the rectus femoris element of the quadriceps. It's check the both hip flexion and knee extension strength simultaneously. It can be carried out passively by it also called the losses sign. The losses test, it's used to determine whether the patient with low back pain and any underlying nerve sensitivity located at the L5. Next, I'm giving a picture, the technique of the straight leg rising tension. Here we see that the patient is lying down on his back and the examination table. Then the examiner lifts the patient's legs. First, if variation is there, the 0 to 35-degree angle, then 35 to 75-degree angle. It's determined that, however, the patient can raise his leg. A variation is the left while the patient is sitting. However, this reduce the sensitivity of the test. To in order to make this test more specific, the patient's ankles can be dorsiflex. I give the picture, and the cervical region also to be flexed. Next, here I discuss some investigation, that not fast when a patient come with the sciatica. At first we don't give any investigation, just like first we give we some wait for some days, then we can prescribe that, we can advise an x-ray. It x-ray that can affect the nerve holes and nerve root. Then we can give an MRI. The MRI also, yeah, it's a detailed image if there is any soft tissue, any herniated disc is there. If we not found anything in MRI, then we advise CT scan or CT myelogram. The dye is injected according to the spinal cord and spinal nerve. Then it makes easier to check. Then another things we can do, that is electromyography. It is EMG. It's also electrical impulses produced by the nerve roots, and these responses to the muscle. This can also be confirmed. It's a case of sciatica. Here I give a brief point, some points of differential diagnosis. What is the differential diagnosis of sciatica pain? A Some list is there. First, the herniated lumbosacral disc. This can also pain. That pain also started from the low back region. It's also sometimes we think that it's a sciatica. Cauda equina syndrome, the muscle spasm. The nerve root impregnate, any epidural abscess in that area, then epidural hematoma for injury or anything, any tumor and port disease. And port disease also we can know as spinal tuberculosis is there. That pain also going to start from that particular area. Now we just jump to our main topic, that our medicine, our how can our homeopathic medicine acts in that sciatica. Everyone know that our this medicine Ammon muriaticum. I think we are. Can anyone use Ammon mur in sciatica? Please give a reply or response. If any, can anyone use in Ammon mur in their clinical practice? Please also okay. Then I will tell. The symptoms of Ammon mur is the from the this I think from the Kent. The tension in the posterior part of the thigh when walking, and the body we can everyone check that contractions of the hamstrings muscles and hamstrings tendon. The sciatica, here the Ammon Muse sciatica aggravated during sitting, and the pain is ameliorated better in lying down. And the sciatica pain, as from Clark, the sciatica pain as if the tendons were too short and aggravated by sitting and walking. From Hanniman's chronic disease, the lancinating pain in the left hypochondria. From this one, these things I collect from the Ammon Mure and the Ammon Mure. Another things we all know that it's periodical aggravation, and the periodical aggravation is according to the bodily region affected. The head and chest symptoms of ammon is affected in the morning, the abdominal in the afternoon, and pain in limbs that like our sciatica pain also, and the skin and febrile everything is aggravated in the evening. And another things we can found in ammon patient, we generally know that excessive fatty deposits around the abdomen, and this patient's abdominal symptoms generally appear during pregnancy, and the pain dislike from ulceration. I can give a picture of ammonium uraticum, everyone can see that. And next our topic of discussion is that's medicine Anagallis arvensis. This one also we know that this medicine is used for lodging the fish bone. Is Bengalis the common know the মাছের কাটা ফুটলে অ্যানাগেলিস খেতে হবে. Am I correct? Everyone is, please reply anything. The Anagallis, but this can also use in the case of sciatica. Anagallis arvensis, scarlet pimpernel. I'm giving a small picture of this medicine, this medicinal plant. And here the symptoms is the dementia with sciatica. Dementia with sciatica from the Palford Dictionary found that the patient is laugh out loud, and the symptoms are aggravated by touch and eating. We can everyone know that Anagalis also have actions on the marked actions on his skin. The skin is itching, dry, and especially of hands and finger and palms are generally affected. It also ringworm, ulcers, and swelling. And sometimes this can also use in urinary complaints also, that irritation in the urethra. Okay, I can jump to the next medicine. This is the antimonium arts. The antimonium arts or arsenite of antimony. The symptoms of sciatica is the symptoms is wandering sciatica where some change his location. This is from the Clark Materia Medica. The pain comes and goes suddenly, and we can everyone we know that antimers is for the lungs, for the lungs remedy. It's useful in the emphysema and excessive dyspnea and cough. With increased mucoid secretion, and the cough is aggravated at eating and the lying down. And sometimes in the myocarditis, we also use that antimonium arsenicosum and antim-ars. In short, we or the homeopath called is antim-ars. Okay, I jump to the next slide. It's our adrenaline. The adrenaline, these sarcodes, everyone know that adrenaline. Adrenaline, it's also the left-sided medicine, adrenaline. Adrenaline, its left foot and left buttock feel numb, and it's also the numbness. Numbness is there, just like Nephelium, our famous remedy for sciatica, Nephelium. This numbness, numbness also extended to the whole lower extremities. That we all also know that adrenaline is the drug was proved by the Dr. Gartman in 1904. And here I some give some physical general of adrenaline. Its appetite of adrenaline patient is increased, just like ravenous hunger. And the sleep is always the patient is sleepy and great drowsiness, and dreams of lascivious dreams throughout the night wakes him from sleep for his dream. And the patient is that mental symptom is of the patient is great loss of strength and rapid emaciation is there. And another characteristic symptoms of adrenaline is the bad taste in the mouth on waking. The everyone we can know that adrenaline is frequently indicated either to complete a cure or to open a case. Okay, the next choice of our drug is Aragelis lamberti. Please, can anyone tell me their Aragelis lamberti and here the symptoms, any symptoms of Aragelis lamberti? Please, anyone write down in comments, or the white loquid or rattleweed Aragelis lamberti. It generally acts on the nervous system, just like the drug is a bewildered, like a confused state, the bewildered state of mind, that confused state. Here I give the picture of the drugs. It's like you can look that the drug is I mean, the tree is looking like that only. And here the symptoms of Aragelis in sciatica, and it's also the left sided sciatica nerve is affected. The cramp aggravate while walking. The cramp always aggravate when walking. And the another symptom is the mind symptoms of Aragelis is so important. That depression worse in the morning and in the evening. The patient cannot study, always cross, irritable, and restless, and difficulty in concentrating the mind, and the lack of ambition, defective expression during his writing, restlessness and aimless wandering, just like the tree. The symptoms also same like that. And next drug is our agaricus. Agaricus, everyone we know that uh, this is also a common drug, but general sciatica symptoms is the violent sciatica pain. Whenever the patient changes the position, that is aggravation on stooping or walking, and the better by sitting is the characteristic. This also is a left-sided sciatica. And another symptoms of agaricus is the cold creeping sensation. Cold creeping sensation when the pain start, there is a cold creeping sensation during attack. And there is always a splinter like pain in the tongue always, and the patient is thirsty all the time. And the patient feels an empty irritation, just like tasting an apples. And the nervous disturbance, and sometimes the patient feels burning in the stomach. And tried that, and the aggravation of the patient is open air or cold air, and the pressure or dorsal spine, and the patient ameliorate the moving out slowly. Okay. And our next drug is the buforana. Buforana, we can everyone know the source of buforana. Buforana is the burning sciatica. It's one line, it's a burning sciatica. The poison of the toad is the burning sciatica. And the lower limb becomes straight and stiff before the attack. The sciatica, the lower limb is stiff before the attack. The pain in the loins and numbness and cramps, staggering gait. The swelling of the bones is there, swelling of the knees and with pulsating and distending with the pain. And our next discussion is our most famous Calcaria curve. Calcaria curve, we know that I collect things from the Allen's handbook. The sciatica pain is aggravated after walking in cold water and ameliorated the lying on affected site. The Calcaria patient, we know that fatty, chubby, chilly patient. But his sciatica symptom is the aggravation after walking cold water and ameliorated on the lying on affected site. That cramps in calf and weakness of the extremities with swelling of the joint. We all know that sciatica patient is desire for eggs and salt sweets and sometimes loss of appetite when the patient is overworked. The patient told that যখন কাজের মধ্যে থাকি তখন আমার কিন্তু খিদে ভুলে যায়. Everyone, we can see the calcaria cup patient in our clinic. Okay. The next, also the calcaria generally we use in the gynecological cases and some cases like that. Any eructation, sour eructation, skin symptoms we can use in calcaria cup. I'm also using calcaria cup in the case of uterine fibroid. Uterine fibroid also use calcaria cup. The profuse flow of menstruation before menses, there is headache, colic, and chilliness, and leukorrhea and dysmenorrhea is sometimes the toothache and cold damp feet during menses is there. Okay, the next next drug is our Carlsbad Aqua. Can anyone use this? Please write in comments. Carlsbad Aqua. Is anyone use in case of sciatica or anything, any other disease? Carlsbad Aquatic is used. The water of the Spradle Springs. The Carlsbad Aqua is the symptoms of I collect from the Clark is the cramp in the left ankle with sciatica. There is a Clark write that the guns cure a case of sciatica by use Carlsbad Aqua. It generally affects and repeated after 2 to 4 weeks. The pains are the dislocated and spraining, drawing, tearing, stitching, burning, dull shocks and jar. That there is a mind symptoms of Carlsbad Aqua is discouraged and anxious about the any domestic duties. And the symptoms also the patient's tongue is coated white with offensive smell from the mouth and sour and salty taste is always in the mouth, and urinary the urine just stream is weak and slow, only passes by pressing the abdominal muscles that the patient can pass the urine. Is if I forget any symptoms, please everyone write in the comments. I also know from your comments. Next, our medicine is carbonium sulfuratum. The alcohol sulfur is the bisulfides of carbon. This the broken down patient, the very useful the patient broken down by the abuse of alcohol. This generally used. And its characteristics of sciatica is flying, pain, and returning regularly for a long time. And the cramps, always the cramps in the links, and the characteristics of the pain is lightning, just like lightning like pains with cramps, and the fingers are swollen and insensible, rigid, and the stiff. The modalities of the this patient is aggravation in the bathing and amelioration by the open air. And sometimes the body from body we I can see that the diarrhea of the carbonium service every 4 to 6 weeks the patient suffers from diarrhea, and the paralysis with the intense congestion of the nerve centers, the sensory difficulty in the limb, and the patient is too sensitive worse in the cold and wasted muscles and skin. And our next drug is sorry. Next drugs, the liver remedy, the great liver remedy, Chelidonium majus. We are also known that this one is the liver remedy. Can anyone this use in sciatica? Chelidonium majus is also this is the right-sided sciatica. Right-sided sciatica and the knee burning sensation. The sciatica pain, always the pain in the icy coldness is there. In the fingertips, the pain with icy coldness. And the pain in the hips and the thigh. And the intolerable pain generally feel in the heel region as it is pinched by a very narrow shoe. And the patient is Sciatica pain with the both legs are swollen. Chilliness symptoms aggravated in the afternoon, evening till midnight. And the patient feel better by the giving warm water. ডাক্তার বাবু আমি গরম শেক দিলে ব্যথাটা আমার ভালো থাকে. And the patient is extremely sensitive to touch. The chelidonium patient is generally that patient the having the eating relief, all the symptoms relief temporarily by the eating. It's generally the hepatic remedy. We know that the patient is preferred the hot food and hot drinks, and nausea vomiting better, the better by taking the very hot water. The patient wants anything hot. That we generally see that patient comes in our clinic, গরম চা যেটা কেউ খেতে পারবে না সেটা চেলিডোনিয়াম পেশেন্ট খেয়ে নেবে. And the next this much for chelidonium. The next discussion, the drug is the causticum. That our well-known remedies is causticum. I am used too many cases in sciatica causticum. Caustica left-sided sciatica. We also know that left-sided sciatica with numbness from roaring. But the Allen told Allen's handbook, we can see that right-sided sciatica, but the with contraction is there. We all know that the sciatica is left-sided from Allen, Boric, but from Allen's handbook, the right-sided sciatica with contraction is there. Then also know that causticum also having the paralysis of the single parts. And the causticum patient Hanneman Acris Stein centuries. And the causticum patient is always the dull tearing pain or also hand and arms. Also, the patient have restless legs at night. The cracking and tension in the knees is there. I think Afsar Ali sir is there. Afsar Ali sir, you can remind that we are curing a old lady in our NIH OPD by giving causticum. Causticum in 50 millisiemens potency.
Yes, I remember. During your internship period.
Internship period, that lady come from the Murshidabad.
Yes. So many patients. It is a
So many
blessing.
patients. Causticum is
Causticum is a
generally used.
blessing.
Okay, sir, I'm going to next slide. The next medicine is the colocynth. Colocynth also left-sided sciatica. The left-sided sciatica and the drawing and tearing pain that's aggravated by the gentle touch and ameliorated by pressure and the heat. Colocynth also a common medicine to use in sciatica. I also give in my clinic the colocynth, diascoria, causticum. It's the common medicine I can use every time. We not only I, the everyone, the every doctors are using the colocynth, the bitter cucumber in sciatica pain. The colocynth patient's mental symptom is the extremely irritable, generally become angry when questioned. If I question the patients repeatedly, আপনার কোথায় ব্যথা হচ্ছে, কিভাবে ব্যথা হচ্ছে, the patients become angry. Generally, কেন বারবার প্রশ্ন করছেন, like that he or she told. That anger with indignation, like chamomilla, Staphysagria, the indignation is there. The pain, the cramp-like pain in the heel, the pain from the hip to the knee, and the tendons like feel too short. And also there is colocynth also have pain with numbness. And our next medicine is discussion is diascoria. This is also common medicine. Can anyone tell me any symptoms of diascoria anyone is using, or like that diascoria villosa, the wild yam? Diascoria also sciatica pain shoot down to the thigh. This also the aggravation in the right side. And the patient ameliorated when the patient is perfectly still. The adjective is used, perfectly still. And the pain in the aching and stiffness in the joint. And diascoria patient, there is a peculiar mind symptom, the call things by the wrong name. And the dull pain in the both temples, better pressure, but the words are in afterwards. Diascoria is generally used in the phelons. In infection is there. Nails brittles is generally used. And our next discussion is the Elaterium officinalis. Elaterium, the squirting cucumber. It's generally is a very certain and effective remedy in the dropsy. And the symptom of sciatica is the shooting, also the dull aching pain. The characteristics is the pain of dull aching pain in the course of the left sciatica nerve to the instep and toes. With that, the patient is having the profuse watery stools coming out with the gush, just like our allopodophyllum. And this also used in the beriberi. And sometimes the patients having very much weakness with nausea, vomiting. Every time the patient suffer from the very much weakness is there. And the patient is having pain in the hip joint, that also with associated with diarrhea is that there. And is generally used for the dropsy, and marked that urticaria and mental disorder come after the suppression of the malaria. And our next drug is the flavus, the Neisseria gonorrhoeae. The flavus Neisseria gonorrhoeae. This also the left-sided sciatica, and that pain in the left arm, and the symptoms is there the poor digestion. Sorry, I'm just give a wrong information. The flavus is the Neisseria pharyngis. I give a wrong information is there. Flavus is prepared bacteria called Neisseria pharyngis, and the left-sided sciatica with the pain in the left arm. That poor digestion and the frequent nausea after meal. And sometimes there is a peculiar symptoms of flavors is there. Everyone that's bleeding during the ovulation period, and with the females are having irregular menses, dysmenorrhea, sometimes menorrhagia, and with endometriosis is there. That patients is aggravated during the cold and in the morning, and the patient is better by after a hot bath. The next discussion in the ginseng quinquefolium. Can anyone tell me any symptom of ginseng? It's generally we all use this thing in our clinic or in our chamber everywhere. Can anyone please give me any symptoms of ginseng? Ginseng is the sciatica pain or any other symptom for ginseng. Ginseng quinquefolium, that Aralia quinquefolium. It's a stimulant to the secretory gland, especially the salivary on the lumbago. It's useful in the lumbago, sciatica, and rheumatism. The I collect the symptoms from Clark Materia Medica is a sciatica nocturnal digging pain. Nocturnal digging in the right lower limb from the hip to the big toe, একদম কোমর থেকে শুরু করে ব্যথাটা পা অব্দি, hip to the big toe, with the heaviness in lower limb and cracking in joints. It generally acts on the lower part of the spinal cord, and the contraction is there, and the sometimes the bruised pain in the lumbosacral region. Bruised pain is there in the lumbosacral region. And the ginseng tonsillitis is like belladonna. Is belladonna the swollen tonsils, and but the belladonna is used in the people in the fair complexion, but the ginseng is used in the dark complexion people. We jump to the next drug, Nephelium, which everyone is used the Nephelium. I don't know is Gotham Pulsar is there or not in our. I remember a case of Nephelium. Sir told me to give single dose of Nephelium 200, one dose, and I wait for this patient 2 to 3 months. The patient is coming every month and then, ma'am, I am feeling better. I was giving 200 only one dose. Nephelium polycephalum. Nephelium is the pain with numbness. The sciatica nephelium is the pain with numbness and cramps in the calves and the feet. When the feet when in bed, and along with rheumatic pain, the ankle joints and leg, and the pain aggravated. sorry, the pain ameliorated in the drawing the limbs arm পাটাকে টেনে ধরলে ব্যথাটা কমে, and the flexing thigh and on abdomen. This medicine also having the rheumatism with morning diarrhea. The Boric told the remedy of unquestioned benefit in sciatica. First line of the Boric, the right, the a remedy of unquestioned benefit of sciatica. When the pain associated with numbness of the affected part. The drug is the nephelium. And sometimes the numbness alternates with pain is there uh, in nephelium polycephalum. Okay, our next drug is the hippuricum acidum. Hippuric acid. Hippuric acid also a rare medicine in case of sciatica. I don't know if can anyone use. I never use this hippuric acid in case of sciatica. Sciatica, that pain extending down to the hip, and the pain in thigh and posteriorly shooting down the right leg, and the right sided especially affected to the menstrual flow for the 3 weeks with complete relief of muscular and joint pain. Menses flow continuously for 3 weeks, then the muscle and joint pains get ameliorated. It the chief action of this hippuric acid in the eyes and the nasal pharynx, and that always a sensationic lump is rising from the stomach, and soreness and at a pressing pain in the liver. Can anyone add any other symptoms of hippuric acid? I also learned from this. Okay, our next drug of discussion is the indigo, that the blue flower indigo tinctoria. In indigo, the dye stuff. In indigo also the marked action on the nervous system is there, and it's the Boric told that's the undoubted benefit in epilepsy. But the sciatica pain is the pain from the middle of the thigh. The pain start from the middle of the thigh to the knee, and the adjective use of boring pain in the knee joint is ameliorated when walking, and the pain in the limb aggravated after every meal. After every meal, the pain in the limb it's aggravated, and these symptoms also having the characteristic symptom the metallic taste. And the mental symptom of the indigo is the always in the excited mood and always want to be very busy, the busy person of materia medica. And also use indigo generally stricture esophagus is very common use is indigo tinctoria. And our next discussion of the drug is iris vars. Iris vars also the medicine the sciatica, also left hip joint, and pain extend to the popliteal space and aggravated in the evening, at night, and ameliorated by the continued motion. This patient also having the lack of appetite or deficient appetite. Our next drug is Calibi. Calibi you also used it left side sciatica. It's also commonly used. The left-sided sciatica better by motion. ডাক্তারবাবু আমি চলাফেরা করলে আমার ব্যথা খুব ভালো থাকে. And the pain fly lying rapidly wandering pain that rapidly from one place to the another, and pain along the bones. It's aggravated by during cold water, and the patient dislike water, cannot digest meat. A Calibi patient. And our next discussion is the lachesis. In early left-sided medicine, we also all know that sciatica right-sided better by lying down. The patients, there are too many symptoms of lachesis is there, but I can't discuss. There is a short time for our seminar. There is shortening of the tendons, and the patient is craving for alcohol, sleeps aggravation. The patient is too much hungry, cannot wait for food. Our next this lycopodium, this is also common medicine we all use in our in our clinic. This lycopodium also the right sided medicine, that right foot hot and left cold, always cramp in the calves and toes, aggravation in nights. The lycopodium patients mentally we all know that averse to take the new things, the numbness, also drawing and tearing in the limbs, especially when the rest or aggravation in the night. Lycopodium patient also desire for sweet is there, the dreams of accident is there. And our next jump to our next drug, Laccan. Leg can also that flying sciatica, right-sided sciatica. Right-sided sciatica, leg feels numb and sting, and the patient is having constant pain, always constant pain in right hip, associated with the burning in palm and sole, and very hungry. The patient is very hungry after eating and intolerance to milk. Very hungry after eating and intolerance to milk is there. Then I'm jump to the lac asinum. Lac asinum, the female donkey or the ass milk, the medicine prepared from the female donkey or ass milk. The prover is Dr. Chetna Sulka, 1995. 1995, the right-sided complaint. Right-sided complaint, pain in the left hip with lumbago and extending downward. Pain, heaviness and crust sensation is there, and the patient is having another symptom is a fixed idea that he is worthless, and the helplessness is there. The patient's appetite and hunger absent, especially at noon. The thirst with increased with dry mouth and increased perspiration. That thirst decreases and at the short intervals. Our next that sarcodes is there. Next sarcode is lag humanium. Lag humanium also proved is Dr. Jacqueline Hofter and Dr. Elizabeth Halhan in England in 1993. This also the right-sided sciatica. Sciatica ameliorate while sitting and walking. That patient lack of vital heat or with flushes of heat upward. The patient desire of sweet carbohydrate, ginger, chocolate, and salt, and aversion to sour, intolerance to alcohol and milk. The thirst of the lag humanium is the increased, like warm drinks. And mental symptoms like humanium is fear of being detached and all alone in life. Our next discussion is the lac orictogalus cuniculus. Lac orictogalus cuniculus. The sciatica lacked shooting pain through the extending to the right buttock and the thigh. Sorry, extremely sorry. Uh, the pricking pain in the thigh when lying on it. The soles are cold and sensitive. The soles is cold and sensitive. The cramping pain in the calf and top of the thigh. The sharp shooting pain is there. The source of the lact orictogalus is the milk of the rabbit. Milk of the female rabbit. Some characteristic symptoms of lact orictogalus are the patient are indecisive, lack of ambition, then desire to open world, to be outdoors, and the patient is always restless, anxiety and apprehension, fearful, always increased appetite. The patient having thirst for cold water, craving for milk, bread, and aversion to fruits and alcohol. Okay, our next sarcodes it's lag vaccinum floss. The lag vaccinum floss is the sciatica with the rigidity of the posterior side of the leg and just below the knee. While walking, the patient found very unpleasant but not painful. Dry throat with extreme of dysphagia, and the constant talking during sleepy and hoarseness after singing is there. Lac vaccinum flows is prepared from the cream of the cow's milk. And Dr. Schwann, we all know that Dr. Schwann prepared this medicine. The patients having during menses, the patient menses profuse and accompanied by the cramps. Okay, can anyone add any other symptoms of lac vaccinans, flaws in any sarcodes for sciatica? Please tell me. I also learned from your discussion. Our common medicine, the MacPhos, the magnesium phos. Magnesium phos, we all use in any pain. যে গরম জলে ব্যথা ভালো থাকে, গরম সেকে ব্যথা ভালো থাকে। The in case of sciatica, the feet is very tender. And the from Kent repertory single medicine is MacPhos. I will discuss in our later slides that mental exertion causes sciatica and the aggravated by the uncovering the legs, the cramp in calves and radiating pain. The patient also having thirst for very cold drinks. And this is the Oyentha crocata. Can anyone use please any comment please comment sir I also learned the Oyentha crocata can any symptoms of Oyentha crocata, uh, not only sciatica and other. This is also rare, not neglected remedy. Oyentha crocata, can anyone use? Please tell me. I also want to learn from you. Oyentha crocata, the symptom is having pain along the crural nerve and sciatica nerve. The pain start from the back. It's generally used in the epilepsy and convulsion. Oyentha crocata. The common name is water drop what? The convulsion is the burning in the throat and stomach, and the convulsion along the pain start going the back with the cold hands and feet is there. The patient craves cold drinks but cannot drink anything, and the convulsions is generally there is facial twitching is there. Oyentha crocata is used. Okay, the next discussion next is the oxytrophis lamberti. This one also can told any other symptoms. This rare medicines. I also learned from you. Please give any comments in comment section. Oxytrophy lamberti also this like Vayanta, this acts in the nervous system. Generally, it's act in the nervous system, but there is congestion in the left sciatica nerve, and also there is pain in ulnar nerve also there. The pain, but the sciatica pain, the stitching pain in the right leg and knee joint, for it generally stays half an hour. uh, the patients having stool like just like aloe just like slimy diarrhea and like lump of jelly, and the patient having symptom when think of his urination, the patient having urge for urination is there. uh, the symptom also having the oxytrophis lamberti, the locovit. The common name is locovit, and the pain, the characteristic of the pain is pains come suddenly and go suddenly. The appetite is gradually increasing, and it's aggravated after eating. All the symptoms aggravated after eating. This is our next medicine, Oleum Jack. This thing I also everyone is used, a common medicine everyone is used in our clinic. Can anyone tell any symptoms? Oleum Jack. Our juniors, seniors also they are in this discussion. Please tell any symptoms of Oleum Jack SLI. Cod liver oil, the medicine prepared from the cod liver oil. The Barnett told this is a pancreatic remedy. But there is the sciatica with the affected limb, and another the sciatica with the atrophy of the affected limb. Sorry, the another medicines of atrophy of affected limb we check in the synthesis repertory is the calcarea, causticum, gloninum, and plumbum mate. Plumbum mate also in the Kent repertory also written the sciatica with atrophy of the affected limb. It's patient is emaciated, but emaciation with hot hands and legs, but is generally internally a nutrient, hepatic and pancreatic remedy. Sleeplessness after 3 a.m. The patient's having dreams of ghost and abnormal hair growth here and there, and restlessness and feverishness and at night. Patient in during fever, the patient is chilly towards the evening. And we all know that oleum is generally used in tuberculosis in the beginning stage. It's generally used. Okay. Okay, our next drug is sorry. Next drug is palladium. Palladium metallicum, love of approbation. Palladium metallicum. The symptoms, mental symptom, love of approbation. Body line. The patient is keeps up brightly when in company. The sciatica symptom is that it's a right-sided sciatica with dull aching pain, aggravation towards nights and in evening, and amelioration by warmth and rest, and heavy and tired feelings in the limb. The fleeting and neuralgic. The characteristics of pain is fleeting and neuralgic pain in the extremity, and darting pain. The darting pain feels in the toes to the hips. Also, the female symptom is a gladyleucorrhea. Female symptom is there is gladyleucorrhea. Our next drug of discussion is sorry, phytolacca. This is also a common medicine. We are all used in our uh, clinic. The syphilitic sciatica. Phytolacca is the syphilitic sciatica. Sciatica with the sharp carting pain in the hip, phytolacadicandra. Drawing cannot touches the floor. The pain runs outside the thigh, aggravated the sleeps in leg pain in legs. Patient dreads to be alone. That pain like shocks. Pain in legs, patient dreads to get along. The sciatica pain, the symptoms of this mental symptom is there, that loss of personal delicacy. And sciatica patients, another pain is the rheumatism of the abdominal muscle. Rheumatism in the abdominal muscles is there. And our next group of discussion is the ruta. Ruta also used in injury. Ruta generally used. Later slide I will discuss the ruta. Uh, Ruta patient is injury. Can prepare a single medicine is there. Ruta. Ruta sciatica worse by lying down and pain from the back and extending down to the hip and thigh. The hamstring feels shortened and the thigh pain on stretching the limb with great restlessness. Narayan is the single medicine ruta history of injury and sciatica with burning aggravation by cold weather. Cold weather. Our next is saccharum lactis. Everyone know? Can anyone add any symptom of saccharum lactis rather than sciatica? Any symptoms? The saccharum lactis, adjective is used as a full pain extending down the whole of the right sciatic nerve, with the hot flashes in the lower limb, pain in the forepart of right knee to anterior superior spine of right ilium and passing back to the middle of the sacrum. The patient also having great thirst for large quantity of very cold water, desire of dainties and lactose intolerance is there. The medicine is prepared from the milk sugar, and also the patient having pain as if produced by the fine icy cold needles are pricking is there. Our next discussion is the strontiana carp. Strontiana carp with the sciatica with the swelling or edema of the ankles, and the symptom is rheumatism with diarrhea and sometimes loss of appetite and aversion to the meat and craves beard and the beer, and the irritation after eating is there. Our next discussion is the Spyranthus autumnalis. Please, this one also rare medicine. Can anyone tell any symptom of Spyranthus? It will be helpful for me also. I also learn new things from you, the Spyranthus autumnalis. Please, can anyone please add any symptom of Spyranthus? The ladies' tresses. It's generally used for the milk flow in the nursing woman and lumbago and rheumatism. And it's a symptom with the congestion and the inflammation. The drawing pain in the right limb, desire for all acid with constant thirst is there, spyranthus. And the patients having sweat on palms. The hand feels alternately hot and cold. And the next, our pure flint, Silesia terra. That sciatica with the pain through hips, legs, and feet. The cramp in calves and soles, loss of power in legs, with icy cold and sweaty feet. The claps tense and contracted, the disgust for meat and warm food. Silesia also the common medicine we all use, but can anyone used in case of sciatica pain? Please, or any other symptoms I left, please tell. I also want to learn all of you. Sorry. The next group of discussion is the salicylicum acidum, salicylic acid. Salicylic acid also sciatica, salicylic acid also not too much common, but this medicine is the symptoms point to use its rheumatism, dyspepsia, and generally for Meniere's disease. The sciatica with the this also the burning pain aggravation at night with a history of recurrent fever and past history of many allopathic medicines given, with the copious food sweat and ill effects when suppressed. The canker sores and the with burning soreness with the halitosis is there. The tongue is purplish and the leaden color. And there is a one line is written, the fermented dyspepsia. Fermented dyspepsia. And the cause of the salicylic acid, one is the past history of many allopathic medicine, and another is the food sweet and the ill effects of food sweet suppression. Okay, our next discussion is the, sorry, tellurium. This thing, can anyone use the tellurium in case of sciatica? We generally use it in case of skin symptoms, skin and ringworm. Please tell, can anyone use it in sciatica or not? Tellurium metallicum in case of sciatica. That herpes circinatus we use. The Boric wrote a line, a very sensitive back. The symptom of sciatica is the sciatica worse on the right side with coughing, straining at night with a sensitive vertebral column and the contraction of the tendons and the back of knee and pain in the sacrum and craving for apples is there. And the sciatica in repeated we can see the sciatica aggravate after passing stool, after urinating, that there is a medicine is there in tellurium. Can anyone add any symptoms? It's generally a skin remedy or any other symptom is there. Otorrhea, eczema in the ER is there. Headache for you, we are all using. Okay, I'm jumping to our next medicine, Xanthoxylum fraxinium. This thing also, can anyone use in case of sciatica? Xanthoxylum. We are also in the end part of our discussion. Please tell anyone, can if anyone use Xanthoxylum fraxinium in case of sciatica. Xanthoxylum also specific action in the nervous system and mucous membrane, especially hemiplegia. Sorry, especially hemiplegia with painful hemorrhage. Painful hemorrhage is there. And xanthoxylum symptom of sciatica is the sciatica worse in hot weather. Sciatica worse hot weather, paralysis of the left side and following the spinal disorder, and numbness of the left side, and neuralgic shooting pain as if from the electricity all over the limb. And the sciatica, the dreams of flying, and sleepiness and neurasthenia. Neurasthenia, there poor assimilation is there. And our next and the last drug is the Valeriana officinalis. Valeriana officinalis. Can anyone add any symptoms of Valeriana in case of sciatica or anything? The Valerian, the changeable disposition is there. The hysterical flatulence, the hysterical use in the hysterical people. The Valeriana sciatica patient is sciatica aggravation, the strengthening out the limb, and by standing or resting the foot on the floor and ameliorated by walking. The patient is otalgia is there, otalgia from the exposure to cold, and the patient suffers from diarrhea, thin watery diarrhea with lumps of coagulated milk, and violent screaming in children is there. The patient is a pain in the heels when sitting. And here I'm just going to discuss some single medicine, some repertory and any other material. Here I collect some medicine of uh, synthesis, that synthesis repertory, single medicine, so many medicines is there. I just write a few medicines. Bladder urination dysuria accompanied by the sciatica nerve with left sided pain along the left sciatica nerve. The single medicine is the agaricus. And if there is burning sensation, the single medicine is salicylicum acidum. If this symptom in the daytime, there is colocynth and sepia. And daytime amelioration single medicine is ruta. And the another medicine is accompanied sciatica accompanied by the chilliness is leg. There is two medicine is there. Second grade is Nux vomica and first grade is third grade is Bambusa arundinacea. And another medicine I can add this in synthesis from synthesis repertory. Sciatica with diabetes mellitus. There is single medicine is creosotum. And sciatica with lacrimation, pain from the sciatica nerve. There is first grade is pulsatilla. If salivation during pain, sciatica pain during salivation, there is mesoerium. Hip jerking during sciatica pain is the calibi. Stomach complaint with sciatica pain, there is veratrum album. Sciatica pain with discharge from ear, there is viscum album. And from Kent repertory, I just discussed some medicine. Croupy cough in the winter and alternate with sciatica. We all know this is staphysagria. And Nux, second grade is the chilliness in the leg with sciatica. First, I told that MacFoss. MacFoss is mental exertion causing sciatica and uncovering leg aggravation. And some that's like pain comes suddenly and goes suddenly. We also think that belladonna or calibrum, but there is other medicine is there, MacFoss and sulfur. And from synthesis is there carbolic acid, chromicum acidum, colocin, calibrom, ovigalen pellicule, and oxytrophies. And if I told that pain is gradually increasing, then first grade is tannum, then argentum nitricum, then platina, then sulfur, and then veratrum album. And can anyone told any symptom of viscum album in sciatica? Viscum album sciatica is the, please can anyone told anything? Viscum album sciatica is a tearing and shooting pain. Tearing and shooting pain is there. And can anyone told of symptoms of ignitia in sciatica? Ignitia in sciatica is sciatica in winter season. Here I write some medicines that sciatica from Pathak's repertory. The ascending pain of sciatica is ledum, nux vomica, ruta. I just already told this, the atrophy of the parts with like calcarea, causticum, oleum jacaris, and plumbum. Bed turning aggravation is single medicine. Pathak's repertory is natrum sulf. And the blowing nose aggravation is graphitis. And coughing aggravation is capsicum, causticum, sepia, and tellurium. And the sciatica alternating with cough is single medicine staph. And the stool aggravation is the single medicine Raxtrox. And this one I discussed some medicine just like bed aggravation. Bed aggravation, sciatica pain, bed aggravate. There is caliite, hypericum, calibicrom, lycopodium, and rutam. And another medicine, here I write the walking aggravation. Walking aggravation, you control everything. In the second grade is cinnamon sulf, colocin, sulfur, and ledum. And another medicine is the third grade Baritacar, Barbaris, Coffea, Ignitia, Lachesis, Natrum, Sulf, Sorinum, Zincum. And amelioration, first grade is Ferrum and Raxtox, and second grade is Cocculus and Valeriana. And another is Agaricus, Ammonmure, Capsicum, indigo, calibi, caliiode, califos, lycopodium, phosphoric acid, ruta, sepia, syphilinum. And winter aggravation, sciatica pain is ignitia, already I told. Stool before aggravation is the baptisia. During stool aggravation is the second grade is nux vomica, raxtox, tellurium, and the colocin. And sneezing aggravation is sepia, and second grade is tellurium. And I just add something. Hang down the leg, পাটা ঝুলিয়ে বসলে sciatica ব্যথা বাড়ে. We all know that valeriana, but two drug is there. Two drug, one is calicarb and one is mandagora. And another medicine in hand over the side of bed, the letting the leg, that also aggravate. This is, there is the single medicine is veratrum album. And lying down aggravation, lying down aggravation is the caliart natramure, and amelioration is the ammon and Bryannia cobaltum. And lying the back on aggravation also Caliard Raxtrox. And amelioration, lying the back, কোমরের ওপরে শুলে, পিঠের ওপরে শুলে আমার sciatica ব্যথাটা ভালো থাকে, সেটা সিঙ্গেল মেডিসিন হচ্ছে ফসফরাস। আচ্ছা, lying on painful side, lying painful side aggravation হচ্ছে ফার্স্ট গ্রেডে ক্যালিআয়োড, লাইকোপোডিয়াম, রাক্সটক্স। সেকেন্ড গ্রেডে হচ্ছে ক্যালিকার্ব, ফসফরাস, টেলুরিয়াম। আর lying on painful side amelioration, Bryannia ফার্স্ট গ্রেড, সেকেন্ড গ্রেড হচ্ছে কোলোসিন্থ। Lying down the right side aggravation, Raxtrox, amelioration, phosphorus. And আমার হাঁটতে শুরু করে sciatica ব্যথাটা বাড়ে। This one is the Raxtrox and Gelsemium. আর যদি কন্টিনিউড মোশনে হাঁটতে থাকলেই sciatica ব্যথাটা বাড়ে, আমি অনেকক্ষণ ধরে হাঁটছি তখন আমার ব্যথাটা বাড়ছে, দ্যাট ইজ দ্য কোলোসিন। অ্যান্ড যদি অনেকক্ষণ হাঁটতে হাঁটতে sciatica ব্যথা কমে, দেয়ার ইজ সিঙ্গেল মেডিসিন ইজ মেডোরিনাম। আর প্রেগনেন্সির সময়, ডিউরিং প্রেগনেন্সি sciatica aggravate is the Gelsemium, Lachesis, and Valeriana. প্রেগন্যান্সির সময় যদি আমার সায়াটিকা ব্যথা ভালো থাকে সেখানে সিঙ্গেল মেডিসিন হচ্ছে সেপিয়া। And if I told the some periodical sciatica, the sciatica pain come in the every fourth day, there is a single medicine is lycopodium, and the sciatica pain come in the regular interval. Regular interval is the carbonium sulf. And ওয়াকিং অ্যামিলোরেট হাঁটতে নর্মাল হাঁটতে থাকলে মানে আমি হাঁটছি তখন আমার ব্যথাটা ভালো লাগছে, রাক্সটক্স আর ফেরাম। Anything I forget, please anyone add anything I forget to add here for sciatica, please told. And anything another medicine I will forget to tell here, the thuja, the most common medicine thuja. Thuja is the emaciation of muscle is there during sciatica. Sciatica pain, during sciatica pain the lower leg is emaciated. The patient with the tubercular history and a history of tubercular gland. Anything I forget to add, please tell me anyone. Okay, I would this the end of my slide, the end of my discussion to sciatica. I would just give to thanks to all of you once again to join the session, and my sincere gratitude to my teachers. Especially I would give to thanks here Dr. Shunirmal Sarkar sir. He gives me too many information, too many medicines to add this slide. And also I would thank to Dr. Afsar Ali sir. Sir also gives so many ideas to add this slide. And thanks to my listener. If you people want to add too many things, just tell in comments. I will add in our next slide. Thank you. Thanks to once again. Orko. Orko. Orko.
Hello, am I audible? Hello.
Yes, sir. Yes, sir.
Thank you. Thank you, Dr. Shatashree. Really, it was a very, very informative and
Thank
impressive
you, sir.
seminar. Lots of
Without
information
your
I
help,
got. You took a pain to develop your PPT. So many information we got here. And if viewers use, and I also did not use few of the medicine that you have mentioned, I will try to use it. So many new medicine, rare medicine. Rare means that we do not use, that is rare. Uncommon means which we do not commonly use in our practice, that become uncommon. It is up to our use. Whether if we are using, then it is regular or common. If we are not using, then it become rare to us. So many less used medicine that we came to know, like adrenaline, Aragalus, Bufo, Carlsbad, flavors, ginseng, indigo, and few sarcodes like lac asinum,
sir,
lac
one thing I
humanum.
just forget. One thing just forget. The circuits I am adding from your book only. The symptoms I will add from your book only.
Thank
The
you,
circuits.
thank you. Thank you. You have utilized my book, Metamedica on sarcodes. Thank you. So many medicines are there with indication from the sarcodes also. So an Onanthi crocata, oxytropis, palladium, so many new medicine that I also very rarely use that you have discussed. It was really informative seminar, and we most of the clinician I think will use your PPTs to make them enriched with the therapeutic of sciatica. Um,
Thank you,
few
sir.
of the medicine. Thank you, Dr. Satosri. Again, few of the medicine that Goiacum that I frequently also use. There is lameness, cannot bear heat, there is stinging pain or pricking pain, tearing pain with contraction, aggravation from motion. and emulsion from external pressure. Nephilim is one of the
Nephilim.
neglected medicine and very useful, sorry, guaiacum, very useful medicine in clinical practice. Next, medicine that is frequently used, almost specific, we should not use like macrotinum. Few of the clinicians uh, 2x, 3x using. Next medicine, if there is any history of trauma, in that case we can use also Arnica montana and
Arnica
Rastox,
montana.
depending. Yes, it is also frequently used medicine because one
In
of the cause
injury.
of the yes, one of the cause of the sciatica is injury,
And
bad posture,
another
and
things I forget,
compression also.
radium bromide. Radium
Yes,
bromide after
yes, yes.
radiation.
Uh-huh.
After radiation,
Radium
the pain
bromide.
is start. We generally use in
Yes.
our clinic. I just forget to it. রেডিয়েশন দিয়ে আসার পরই সায়াটিকার ব্যথা বেড়েছে।
Yes, yes, radium bromide is medicine. And a few of the basing on the past history, keeping in mind about the infection in the past history, like measles, we can use morbillinum or
And another
chickenpox
things
in
also,
cases
sir,
of.
I forget medorinum and syphilinum. Barnett told
Yes, yes, yes,
medorinum,
yes.
and I
That
never
I'm
cured
coming.
this medicine that's without sciatica. Medorinum and syphilinum.
Yes, yes, yes. Because if there is past history of these infectious diseases, we can use those nosodes also. Along with that, that's just you told medorinum. Medorinum is another indicated medicine which we cannot complete the cure of the sciatica without use of the medorinum. It is so deep acting medicine. It is most frequently indicated medicine. Another medicine is thuja, which is very frequently used if there is history of vaccination. Nobody is free from the vaccination, especially after the COVID
COVID
vaccination.
patient.
And Thuja is helping to a great extent in cases of, especially if there is left-sided affection, along with all the characteristic symptoms of the Thuja. One thing that I also want to add, that is along with our medication we have to take help of the physiotherapy also, because this is important. If there is pathology, there is compression of the nerve, stenosis or vertebral polyps, in that case medicine along with physiotherapy is must. What we are using in NIH also regularly we are getting relief medicine along with the physiotherapy. Role of the physiotherapy we cannot neglect, and almost regularly we have to refer the patient to the physiotherapy. I request all my viewers and please use the physiotherapy also along with the medication. Thank you. If there is any question, there any question, Dr. Orko? Dr. Orko, is there any question?
No, sir, we don't have any question.
Okay. Actually, it was so nicely described that no one will dare to ask any question. Lots of the information and shared by Dr. Shatashree Ghosh. Thank you again, Dr. Shatashree. Now I will request our sir, our teacher, Dr. President of our
Thank you,
organization,
sir.
uh, Dr. Devran Kalyani sir, for his expert opinion on the topics. Over to you, Dr. Devnarayan Kalyani sir.
Thank you, Professor Syed Ali. It is fantastic seminar. First of all, I should thanks to our junior beloved Tousif Jamal for coming in front, and our wholehearted desire that his friends and they must come forward to continue the CME with their experiences. Please come as a speaker in the next time. Get yourself prepared. And regarding moderation, nothing to share, fantastic moderation. And our target of continuing the CME, that one apex persons, that means persons from the NIH, professor or teachers or alumni, those who are seriously attached with the NIH, they must be moderator. By which our intention is that CME should not go out of the tract of NIH learning, NIH teaching. So these teachers, especially Professor Dr. Ahmed, Syed Afsar Ali, all along he is helping. Whenever you are in trouble, he come forward. Not only he is alumnus of this institute, but it's a brilliant professor. And what to say about Shatashree Ghosh? Fantastic, fantastic seminar. What I think this is different research work, what she has done. This should be preserved in our CME. All of us will be able to use it. Fantastic information. And I might just like to request
Thank you,
Shatashree,
sir.
your brilliancy, please come forward with other diseases. Because one who is expert in one subject, definitely he is expert in some other subjects too. In near future, please come forward. So,
Okay, sir.
so more you will come forward, will feel relaxed, will be happy to see that juniors are coming forward to take the responsibility to continue the CME and to maintain the standard of teachings of National Institute of Homeopathy. So anything, everything, almost everything has been said, especially regarding physiotherapy. Professor has said in details. My simple experience, I should want to tell you that whenever I find a case of sciatica, remember that the target of the disease, what is the reason? Either compression or pathology in the root. So try to keep the root under rest. First advice should be don't bend forward, go for physiotherapy and use your lumbar belt to restrain the normal anatomy of the lumbosacral vertebra as much as possible and to avoid undue trauma on lumbosacral area. That's the first advice. Physiotherapy, refer to physiotherapy is definitely needed because only medicine sometimes is ineffective or will find failure because the physiotherapy minimum aids to keep the area in comfortable places is not being done. So physiotherapy for this is very much essential. Plus, all the patients should advise to consume some foods containing vitamin C and calcium, by which progressive deterioration of the bones, especially the spines, can be arrested. Sun exposure, to take some milk product, to some foods which contain vitamin C, because vitamin C helps to deposit calcium to make the bones strong. Moreover, my personal experience I want to share because I had to work with spine diseases in NI. What I have observed that the cases is suffering seriously, complaining seriously. There is a very common drug but rarely used. What I do usually, I take the photograph, means X-ray. If the case is serious, then CT scan or MRI. If I find there is no such serious pathology, neither thecal sac compression, nor stenosis, nor slip disc, nor dissection of the disc, nor spondylolisthesis, but the patient is complaining seriously. My conclusion was the patient is neurologically hypersensitive. So I have experience in different cases with a very, very common simple drug, which is sensitive to nuts, is hypericum. You could also use it only when there is no serious pathology or there is no specific uncommon symptom as it was expressed by Shatashree Ghosh. Then you can see the effect of hypericum. Many cases will be successful. Maybe completely cure also. But in spite of giving these drugs, as we have learned from Shatashree, there may be some constraints after a period of immunization or even getting relief completely, patient is coming again and again. We should not restrain ourselves simply by giving these drugs, these rare medications. We should observe on the cases. Is the case is repeatedly coming? Is the case is completely cured? If we find that sciatica has been cured, plus some accessory components of the patient taken in the case history has been cured, then your selected drug for the sciatica is the drug for the patient. Be sure that sciatica will be cured along with other components to be cured. That is his only drug. But many times we find that few drugs are worse than palliative. They will give relief of the complaints, troubles will come down, or it will be very much minimized. But the pathology will remain unchanged. After a few days, it will relapsing, or the complaints are completely not going off, or complaints are going off, but pathology is remaining as before. So you should not forget to give our homeopathic prescription on individual basis, what we do, that will be our final conclusion. So that's why in case of sciatic nerve pain, we must treat the patient according to our CME today done symptomatology, but should be very alert that the basic cause of the disease of sciatica or the pathology for the sciatica may not be cared, may be untouched. So regarding myasm, fundamental causes or other basic causes should be kept in mind to complete the cases. We should ask the patient, you are getting ready from this sciatica. Please do not discontinue until I find the radiological reports normal, until I found CT scan is normal, until I found MRI is normal. You should not discontinue. I will tell you when to discontinue, in spite of complete remission of the complaints. That should be our guideline, by which not only will we cure the sciatica, but also will be cure the patient in two sense, homeopathic cure. Anyway, today's seminar is really brilliant. Another asset of our CME. Again, further request to all of the juniors to come forward, serious with their experiences. This type of detailed research, other information, which will help all of us. All of us will progress and progress and progress. Thank you very much. Thank you all.
Thank you,
Thank
sir.
you, sir. Thank you so much on your expert comments and as well as uh, excellent session by Dr. Shatashree and our beloved moderation by Afsar, our beloved brother, and great information to share with all that this year we are going to celebrate the 50th foundation stone laid ceremony, laying ceremony of National Institute of Homeopathy, the 50th birthday of NIH. But in this 105th CME, it's very unfortunate to narrate as a General Secretary of National Institute of Homeopathy that in spite of repeated and very humble submission for last several years to the local authorities of National Institute of Homeopathy, there has been no recognition or something. It seems like what do you say? It seems like the think tanks are ignoring the presence of alumni of NIH. So NIH Alumni Association being founded by the alumnus of NIH and a group of alumnus starting with the founder member, our beloved President Dr. Debnarayan Kalyani sir. So many stalwarts, Dr. Samir Kumar Bhattacharya sir, Dr. Chaturhuj Naik sir, Dr. Aishwara Das sir, all of the first batch of DIPNIH and later on the first batch of BHMS, which started with Dr. Pralay Sharma, Dr. Trideep, Dr. Usha, and so many. Then came the MD batch, which started with so many stalwarts in the first batch of PG courses. So, in spite of so many scholars coming out from National Institute of Homeopathy, we never thought of revealing this topic in the CME. But on the ongoing CMEs, we are trying to unite the homeopaths across the country, across the globe, keeping in mind the National Institute of Homeopathy alumni in prime. But still, it's a very painful observation from the side of the several dedicated alumni who are trying to unite a lot of people across, that the local administration is not at all paying any heed to have the alumni intact, because the presence of alumni in the institute, whatever the educational institute is concerned, it acts as a boon. The successful alumni who are successful in their relevant fields will always boost the morale of the present students. I think our beloved Dr. Afsar will agree with me that if the students they come across the likes of Dr. Partho Pratim Roy of Maharashtra, now a professor, the likes of Dr. Aishwarya Das, the likes of Dr. S.K. Bhattacharya, who already had been a teacher, but the likes of so many teacher non-teachers now, though who are practicing clinically, like Dr. Partha Chakravarti. Then from the first batch, I don't remember sir's name now. One of the founder secretary of National Institute of Homeopathy, the founder president of National Institute of Homeopathy Alumni Association. If these people come across and interact with the students of NIH, the present students who happen to come from all over the country, not only from the country, but also from Sri Lanka, from Bangladesh, from Russia, from Poland, and from the European Union countries. So, will it not be fair enough to have an interaction with the students, the current students, both of UG and PG, and also the faculty members of NIH with the alumni of NIH? So it's my humble request, my it's nothing a threat or nothing to go as a the personal ego clash with anybody else in the administration, but it's my humble and request with my folded hands that please come forward to have a healthy alumni meet in and within the campus of NIH. Alumni Association has been trying hard to run with the biannual publication, Sapere Audi. That's a journal trying to be a peer-reviewed journal now, being headed by so many stalwarts of NIH, all other alumnus of NIH. So it's a humble request to all. Please share your opinion in this comment box of this YouTube or in the Telegram channel of NIH Alumni Association or in the WhatsApp channel of the NIH Alumni Association after my tonight's appeal. Because what Dr. Shatashree had narrated tonight, it has been excellent, and she is not a teacher of any institute. But if we have the talents like this madam or the other who came and spoke, and the speakers who are coming in the future CMEs of our alumni association, will not they not be of help to the present students of NIH? This is my humble request. And with this request, I'll request again the think tanks, the official management of National Institute of Homeopathy, those who are in charge, to please think again and have a respect to the NCH rules also, who had repeatedly been asking to have a healthy alumni forum within the NIH, within the homeopathic colleges itself. So the present and past interaction is always there. This will help to enrich and bring more students in homeopathy. I think so, especially for the private colleges, those who are striving for the students nowadays. Still, anyway, sorry for sharing my emotions. Kalyani sir, I apologize because this came all on a sudden after listening very carefully to the session of Dr. Shatashree Ghosh. I felt really emotional that if we have talents like this sort, why they are not being utilized with an interactive phase with the present students of NIH. I think all of you will agree with this. And with this, with the permission of all the present members in the studio, I'll be returning this session to our backstage editor, the IT manager, Dr. Orko Mukherjee. But please stay back in the backstage studio. We'll have a post CME talks, and apart from that, for the viewers, those who are live here and who will be watching in the later part, our 106 CME is already scheduled and will be there on December 8th with some excellent topic. We will be putting up the topic very soon and with some exciting speakers and a new panel. Over to you, Orko. Oh, there is a technical snag. Dr. Orko Mukherjee is
Bidyut,
not getting his connection. Just let me check, sir.
Bidyut,
There has been
let
a
me
private check.
add a few words, Bidyut, that regarding your
Yes, sir.
pain, all of us are feeling your pain because you are striving maximum for alumni association since beginning. But the fact is that I will give you an example. That in Mahabharata, when Dhritarashtra gave Khandaprastha, the unfertilized rocky area to Pancha Pandava, then Sri Krishna was asked by him that Sakha, why our uncle did this injustice by giving Khandaprastha, unfertilized rocky land to us and giving everything to his son. This is injustice. This type of injustice cannot be bared. Then Sri Krishna replied, "You are wrong. You are not correct. Your uncle loves you much more than two children and their brothers. That's why they have given you a land of karma yoga. He has given you a chance to grow yourself more and more, to break the rocks, to make the area unfertile area highly fertile, to break the rocks and to make a beautiful palace. And you know that a very beautiful, fantastic palace was made there. So it may so happen that our present administration is desiring that we must grow of our own. Let them grow and grow and grow without giving any help. The fact is that whatever administration is doing, we are not at all hard, we are not at all soft or depressed. We love our mother institution, we love our homeopathy, whether we are approved, your, we are neglected, refused, we less bothered because we do not know the constraints of the present administration, why they are not taking alumni association as their own. That is not known to us. Maybe something which cannot be expressed because there are many things, maybe secret, official secret for the administration, we do not know. But our love to the NIH, love for the homeopathy, love for our brothers and sisters will never be less, or it will never come down. Gradually it will grow and grow and grow. The more we will face constraints, obstacles, we will be more strengthened, we will grow more. And as we have reached to 100 and CME, I think this type of CME is a rare instance in the world by the most highest possible brains. NIH alumni are the highest possible brains of the world, and they are maintaining one CME for 105 times. It's a record. We will grow and grow without bothering anybody's consideration. Thank you very much. Thank you very much.
Thank you, sir. Thank you so much. And good night, everybody. We are
Good night to all.
going to end the
Good night,
session,
sir.
and we'll be meeting you again on 8th of December. Uh, and those who are having the participation certificates, please get in touch with our email or in this with our IT experts, with our IT team, Dr. Orko Mukherjee. I think he will be keeping this link alive for a few more minutes or till midnight today. So please generate your certificates online. Good night, everybody, and all the panelists over here. Please stay back for the post CME talks.
Good night. Good night.